Nigeria has one of the largest burden of chronic kidney disease in the world. Each year, about 17,000 new cases are diagnosed, with only 2,000 patients having access to dialysis. Our focus today on Sound Health is on managing chronic kidney disease. I'm Olasumbo Modupe. Welcome to your one-stop health show. The program continues in a moment.
Chronic kidney disease occurs when the kidneys lose the ability to filter waste from the blood sufficiently. Each year, 17,000 new cases of kidney failure are diagnosed, with only 2,000 having access to life-saving dialysis. For Elsie Asibe, who was diagnosed last year, the condition is not just demoralizing but financially incapacitating. At the moment, the mother of four undergoes dialysis twice weekly till help comes away.
I realized I was feeling very sick with symptoms of swollen legs, and I couldn't urinate much anymore. My body was getting swollen, and after a while I couldn't continue with dialysis because of its cost. It's very cost effective, and that has made me emaciate. My body deteriorated this fast. I can't afford the dialysis anymore, and that is why I'm crying for help. That help should come, because apart from dialysis, the major treatment is a transplant. It's having a kidney transplant. That's why I actually want help from people out there to help me out for transplant. It's going to cost a sum of 10 million and above for the transplant. The doctors have advised that I do it too. Staying long on dialysis is dangerous.
Joining me now on how to stem the rising statistics from kidney-related diseases is a consultant nephrologist with the Lagos State University Teaching Hospital, Dr. Mumuni Amisu. Welcome to the program, Doctor.
Thanks for having me, Sumbo.
Okay, 2 to 5 years ago, cases of kidney-related conditions have become disturbing. Families have lost their loved ones at their prime. As a result of this, why do we have the upsurge now?
Yes, we've noticed increase in awareness of the populace in the incidences and prevalences of hypertension and diabetics. People are now aware that they need to come up to be screened for hypertension and diabetics. The prevalence has been increasing, and recent statistics have shown that averagely about 40 million Nigerians are affected by chronic kidney disease in all stages. So we are saying about prevalence of about 20 to 30%, even though we do at present not have prevailing statistics because it still varies, and the renal registry, the Nigerian Association of Nephrology, is trying to compile is not really concluded, but it's increasing largely because the incidences and prevalence of hypertension and diabetes, which are the commonest reason why most of our patients with chronic kidney diseases come down with this condition, is equally rising. So that may explain that. We've seen them more and more in clinics, average about 50 to 20 per day, and in the past probably 3, but these days we can review and see a patient, see about 50-20 patient new cases, and this cut, that's a unit, and this cuts across the region. And if you see that in Lagos, we can extrapolate that and assume that it will be in a larger proportion.
The condition doesn't just happen overnight. Medical experts have attributed chronic kidney disease to lifestyle, some other health-related conditions, too much of salt intake. What are the other causes of chronic kidney diseases?
Yeah, the commonest causes of chronic kidney diseases in Africa, Nigeria, largely are due to hypertension and diabetes. And we also have some other conditions that are not too common, like infection. HIV have been implicated, hepatitis B/C infections have been implicated. They also have some genetic conditions that's responsible for kidney diseases. At times we call polycystic kidney diseases, and a few others. Likewise, abnormal genotype abnormality like sickle cell anemia also be implicated. Well, the event of excessive salt intake, high cholesterol, and alcohol, smoking are added risk factors.
What about holding on to urine?
The studies have shown that they added to the risk of coming down with that. They are not directly related in the CKD, but they can also augment the rate at which individual, when you have background hypertension, you are diabetics, and not upon that continue to take any salts or indulge in high cholesterol meal, take excessive, indulge in smoking and alcohol. All these conditions worsens incidence of chronic kidney diseases in most population we have seen. So as such, managing such patients includes advising them on the need to cutting down those identified risk factors.
Okay, so when should one worry about the state of the organ, that's the kidney, and what are the symptoms to look out for?
Well, when we talk of kidney diseases, we actually have the acute that occurs within hours and days, sometimes weeks, and we also have the chronic one, which is the commoner, that occurs more than 3 months. And when they do have this condition, especially the chronic type, which is most devastating, capital intensive and overwhelmingly disheartening in terms of management, and we see them commonly when they start complaining of tiredness, which is brought of anemia, low blood. They start having problem with eating, they are anorexic, okay? They start having vomiting, and most of the time they tell you they pass urine more than 3 times overnight, that foamy urine, which is evidence of losing excess protein in the urine. Ordinarily, you should not lose protein above particular value in the urine. When it's become excessive, urine foams, and you are going more than 3 times. And most of them will complain of when they wake up in the morning with facial swelling, leg swelling, and subsequently the urine output might be difficult to come out. And this may herald the symptoms and signs that this individual, and as such, when you investigate them, ordinarily kidney functions, if you should start from that, to actually take care of excessive waste in the body, toxins, because we generate toxins in our body virtually every minute. These are nitrogenous waste. They are not needed in the body, and kidneys should excrete them. At the event of failure, this waste accumulates, and the effect is cutting down blood cells, making the blood cells to break down. They have anemia, and they also affect production of blood cells. They also make one individual not to eat. Kidneys also involved in ensuring you have strong bone, calcium, because it partakes in the formation of calcium in the body, so they may have a weak bones and all that. They involve in taking out excess water from the blood. So that when that fails, that's why most of our patients having coming down with leg swelling, facial swelling, and all that. And then largely they produce blood, like I say, and they can, when they are tired or fail, they don't do that. So we look at all this and all the functions they can originally or physiologically can perform. Patients now come down with that, and that's what we see, and we subject them to investigations And the nitrogenous waste are usually seen in the blood test, very high. The typical urea and creatinine they talk about, extremely high. Blood level is usually very low. And when we look at all this with some criteria, we may want to put them on kidney replacement therapy, either dialysis or transplant. So the signs are there, the symptoms are there, and the investigations can be done to confirm that in most of the hospitals or nephrology centers.
Okay. Is it a death sentence, and what is the survival rate for people living with the condition?
Well, it's not a death sentence. First, talking of management, prevention is better than cure, because managing kidney patients is capital intensive. It can be disheartening when one has it, but with the knowledge of science, practice, and care, we now find that when individual screen early, if individual comes from family of hypertension or diabetics, has hypertension or diabetics, and screen early and find out that he monitors his blood pressure, blood sugar, he uses his drug, he may never probably end up having end-stage renal disease. And you remember, like, the conditions comes in stages. Before we start talking of dialysis or transplants, most of these patients are in the end stage. We talk of kidney function as when it's working maximally, as let's say assume 100 mil, 100%. By the time the function drops less than 15 or 10, the way we assess that through investigation. Patient may need dialysis or kidney transplant. So dialysis, most of these patients can be on dialysis to take care of these nitrogenous waste. There are injections they can take to boost the blood level. And definitive management is actually kidney transplants. It provides more quality of life, and people have been on it with many years of over rates of decades without any complication. And we've seen that either in Nigeria and abroad. So it's not a death sentence. There are ways to manage them. There are drugs. And most importantly, because it's capital intensive, prevention will ensure that patients do not eventually come down with...
Okay. Does every kidney patient need a kidney replacement? And moving forward, after the diagnosis, what next? Because there are cases where people are overwhelmed or incapacitated financially. Is it just about the donor, finance, or the success rate?
Not all patients need renal replacement therapy or kidney transplant or dialysis. Like I said earlier, when we start investigating these patients, following the symptoms I highlighted earlier, we stage the strength, the function of the kidney. And like I said, averagely 100. By the time the kidney function drops to 15 or 10 out of 100, what we call glomerular filtration rate, the patient might need dialysis. And some of them, because we know kidney transplant is better than dialysis, so we may offer them that we may have to pursue kidney transplant since its profile quality of life and survival advantage is better than dialysis. So if you are in stage 1, we have stage 1 to 5, 1, 2, 3, 4, depending on glomerular filtration rates. They are not usually placed on dialysis. They don't need kidney transplants. Those that need kidney transplants are those category of patients that have their kidney function less than 15 or less. Okay, so not all category. Likewise, most patients with acute kidney injury, like I explained earlier, I told you we have 2 types. Most of them we do reverse after treating the cause, usually infection and loss of fluid, excessive vomiting or diarrhea or blood loss or infection. You may just have transient kidney injury, and when those factors are treated or fluid loss are replaced, the kidney reversed, maybe they will need a few sessions of dialysis. Those categories too do not need kidney transplants. But in chronic kidney disease tending toward end stage, where the kidney function is less than 15, they do need dialysis. Like kidney transplants in those category of patients are usually better than dialysis.
Okay. Each year, about 17,000 new cases are diagnosed, while only 2,000 patients have access to dialysis. How did we get here, and what's the way forward?
I would say that the management of patients, like I said, over 40 million of Nigerians are in different category of chronic kidney disease, and a large proportion of them, more than 3 million per year, might be having that all over Nigeria. And the question now is, managing such patients includes both, should be involved both the public and private, because it's capital intensive. The dialysis machines are not enough. Bringing them in does not have any subsidy, no tariff cuts, with the high dollar rates. So the cost of dialyzing a patient on the high side. So we talk about adequacy of dialysis. If a patient on the adequacy of dialysis, the patient should have 3 dialysis per week. Okay, to have that per week in most settings in Nigeria, where Lagos where I practice, with the injection for the blood and some other adjuncts, other antibiotics, antihypertensives or drug for the diabetics, one might be spending up to 120,000 per week. Yeah, so per month we are saying 480,000, $500,000. You can imagine spending all that per month, and it's really quite great. So we want partnership between governments and private, and there's a bill in the health insurance bill that the National Association of Nephrology actually pushing for. We've been actually pushing it forward that there should be a subsidy, a cut kind of for patients undergoing dialysis, patients undergoing kidney transplants, either at the level of tariff when the machines are brought in, or on the consumables used to manage the patient with dialysis. So it's really capital intensive. Government and the private individuals should come together and see how we can really abate or ameliorate the tide. Because it's really, I know it's quite heavy, you know. Now every patient that pay out of pocket to take care of your care.
Okay, it's even more disturbing when we have cases of chronic kidney diseases in children. What's the cause of this?
Well, I don't have exact figure for children because I'm an adult physician. I know that most of the cases we've seen with children are due to sometimes congenital problem in the kidney, ureter, and reproductive organ, structure when they are not well developed in pregnancy, and some of them come down with urethra valves.
What would be the cause of that?
It's congenital, it's genetic sometimes, and it's from birth. And some of them do come down with kidney failure, which may acute initially, then progress to chronic kidney damage and all that. They may eventually end up being dialyzed or may need kidney transplants. So the prevalence is there, but it's like chronic kidney disease in adults also on the rise.
Okay, unlike in advanced countries, the number of people with the condition with access to nephrologists is about 1 to 1 million. How did we get here?
The population, the ratio of doctors, nephrologists to those needing care, or we look at the population to the number of nephrologists in Nigeria is quite abysmal in terms of proportion. But then over the years, the colleges, postgraduate colleges are continually to shun out specialists, nephrologists in this field, likewise the nurses, dialysis technician, but all the same, the proportion is still abysmally low. We encourage most of our young doctors to come into this discipline, to be trained, likewise the nurses, so that we can, of course, the population is still abysmally low. As much as we produce, some of them still jet out of the country because the income, because of facilities, because of salary and so many other factors. So we still have to, our government can come in to encourage young doctors to come into the training, to be trained to specialize in the field of nephrology, under dialysis nurse, dialysis, transplant surgeons and all that. Well, we do produce over the year with increasing number, but we know as when you produce 10, before you see within a year about 3 or 4 left the country because of poor salary, facilities and comfort, and well, we still need to be encouraged to ensure the number increases through government policy to improve facility, improve salary, and and make the environment conducive.
So how best can the organ be prevented, knowing fully that we don't have much experts, much nephrologists in the country? How best can we prevent or preserve the kidney?
Prevention is better than cure. Prevention starts from screening. If individual knows that it comes from family, have a background history of hypertension and diabetics, obesity or kidney disease, screening should be done either every 6 months in a specialized center, checking your blood BP, blood pressure, checking your blood sugar, checking your cholesterol. Okay, if the individual is known to have background history of family history of kidney disease, or individual that have died because of kidney disease, should come forward to be screened. Blood, urine, radiology. Sometimes you can do a genetic screening. Some of these diseases are inherited through the genetic disorder. So we advise the individual should come forward to screen and check their urine, check their blood, and do some radiology. Some may benefit from genetic counseling and screening. It's also important that water intake also is very important, and it's advised that at least you take a glass of water, about 150 to 200 ml in the morning, for cleansing, and it helps. Brisk exercise, taking 30-minute walks a day, and ensure that you don't accumulate excessive fats. All this helps a lot. And if you know individual has a family history of hypertension, salt reduction, BP monitoring should be adhered to. People with high cholesterol in their diet should take more of unsaturated fats. Red meats, should be avoided. Take more fish than meat. I mean, the dietitians also come into play to advise. So all this should be. If you smoke, you have to stop. Okay, if you take alcohol, you can't stop. You must drastically reduce it. That way, we quantify the volume that or percentage concentration alcohol on that appears suitable for individual. Maybe half a cup, less than 30 grams a day or week. But then the best thing is to stop.
All right, this is where we say thank you so much for sharing your expertise with us. Thank you so much for enlightening members of the public on managing chronic kidney disorder.
I appreciate you inviting me, giving this information, and I hope this education will go a long way to shaping the public on how to take care of their kidney and preventions.
All right, you're welcome, sir. Okay, that was Dr. Mumini Amisu, a consultant physician and nephrologist with the Lagos State University Teaching Hospital on managing chronic kidney diseases. Sound Health continues with trending and home essentials. Please stay with us. Well, that's the size of our package on Sound Health this week. Hope you've learned a few things. We would like to hear from you. Please share your thoughts with us on 0818-815-3695 or follow us on social media at LTV Social #sound health. A sound health is a sound mind. Make healthy living your choice.